Hi, my name is Shima Shabalut, and the modality that I researched was pulse ultrasound. The research article that I found looked at how low-intensity pulse ultrasound could help heal tibial fractures. The authors of this research article hypothesized that in comparison to a placebo, 16 consecutive weeks of low-intensity pulse ultrasound treatment would accelerate the progression to healing as evidenced by quantitative radiograph measurements of bone mineral density and the reduction in the size of the residual gap area. The purpose of the study is that the authors were trying to prove that low-intensity pulse ultrasound could be used to help people who have tibial fractures with a delayed union, to help that they could use this modality to help heal their fracture quicker. The authors wanted to prove that there were non-invasive methods to help heal fractures. So this is why they chose to have this study. The level of evidence for the study is a level 1, and it was a randomized control trial. The population, there were 101 subjects. They ranged between 14 to 70 years of age. All of them had delayed unions of the tibia. They were randomly chosen to have their treatment conducted either by the low-intensity pulse ultrasound or the sham device the alternative sham device. The inclusion criteria for the study is they had to have a tibial shaft fracture that had a delayed union, and they had to have had the injury for less than or equal to 4 months. The exclusion criteria is anyone that was pregnant, revision or reoperations at the fracture site within 16 weeks of enrollment, deep wound infection, and excessive malalignment. The intervention. So the way that this intervention worked is that the patients that had the delayed unions were they were selected randomly, and they were either given the low-intensity pulse ultrasound as a modality, or they were given the non-operative sham device. Both of the parties were told that they were supposed to do the modality for 20 minutes per day for 16 weeks. They made both of the devices look identical so that the patients would not know what device that they had. So, and each person was told exactly what settings they were supposed to put on for the modality. And there was also a setting in the device to see how often the patient was actually using the device, so that the people who were heading the study could see the compliance of the patients. And so they also, before I move on to that, and the way that they measured after the participants did the interventions, the way that they were planning on testing to see how well they improved or whether they not improved, they tested the patient's tibial fracture via a CT scan, and they measured the gap area, and they also measured the BMD of the patients as well. So the results and the conclusions. So the authors, after conducting the complete study, the authors felt full-heartedly that the low-intensity pulse ultrasound gave the participants who did the low-intensity pulse ultrasound had much better results than the patients who did the sham device. They found that the BMD was 1.35 times larger for patients with that low-intensity pulse ultrasound, and then they also had 65% were healed by participating. 65% of the people who did the low-intensity pulse ultrasound were said to be cleared by physicians who were looking at their CT scans, and the physicians who were looking at the CT scans were also blinded. So they also didn't know who was doing which modality. So that was also another great thing of this study, is that the physicians also were blinded. And so some of the strengths of this study are that it had a high compliance. Everyone that was included in the study was blinded, and there was a large age range. Some of the limitations were it did have a small sample size. There was also a very strict timeline for the fracture, so that could be a little bit of an issue. And it also was such a short time frame. It would have been nice if they could have done it for longer than 16 weeks. And the authors of this research concluded that the low-intensity pulse ultrasound can both accelerate the healing process of the fractured bone as well as improve the chances of achieving a solid union for people who have had delayed unions in their tibia. They also believe that the modality is an effective treatment option for patients with this type of injury. And here are the references. Also, I did want to mention that this was a really interesting article, and it's very, very important. It was just a reminder that as a future occupational therapist, it's very important to be aware of all of the research that's taking part, because instead of having your patient undergo some type of invasive treatment, you could expose them to a modality for 16 weeks like these guys did, and it could help them, it could help increase their healing time rather than having some invasive procedure. So it's always good to know what research is out there, and sometimes the research that you find would be the best possible way that you can help your patient rather than putting them through some type of invasive procedure.